Are stool softeners safe for seniors? Are stool softeners safe for seniors? This is a question many people have, especially when it comes to managing constipation and specific digestive disorders. Let's break it down. Stool softeners are designed to make bowel movements easier by drawing water into the stool. This softens it and reduces the need to strain. For seniors, constipation is a common issue. Factors like decreased mobility, medication side effects, and changes in diet can contribute to this problem. Stool softeners can be a helpful option for relief. They are especially useful when straining could cause discomfort, like with anal fissures or hemorrhoids. From a safety standpoint, most healthcare providers consider stool softeners safe for older adults when used as directed. They are often recommended for short-term relief of constipation. This can be particularly beneficial for seniors with sensitive digestive systems or conditions that make straining painful. However, stool softeners may not be effective for chronic constipation in frail or chronically ill seniors. It is important not to rely on them for long-term use without medical supervision. For seniors with sensitive stomach conditions like irritable bowel syndrome or colitis, stool softeners should be used cautiously. These conditions involve inflammation or sensitivity in the digestive tract. Any medication that affects bowel movements needs careful management. Stool softeners do not stimulate the bowel aggressively, making them gentler compared to stimulant laxatives. However, it is still important to monitor for any adverse effects like cramping or diarrhea, as these could worsen symptoms in irritable bowel syndrome or colitis. Here are some practical tips for seniors with sensitive digestive disorders. First, always consult a healthcare provider before starting stool softeners, especially if other medications are being taken. This helps avoid interactions or side effects. Second, use stool softeners only as directed. Do not exceed the recommended duration, which is usually no more than 1 week without medical advice. Maintaining adequate hydration and dietary fiber intake is also important. This supports healthy bowel function alongside the use of stool softeners. Lastly, be alert for any worsening symptoms such as abdominal pain, diarrhea, or rectal bleeding. If these occur, seek medical advice promptly. In summary, stool softeners can be a safe and effective short-term option for managing constipation in seniors, including those with sensitive stomach conditions like irritable bowel syndrome and colitis. They help reduce straining and discomfort without harsh stimulation of the bowel. However, long-term or unsupervised use is not recommended. Always consult a healthcare professional for any new or worsening symptoms.